Good afternoon, and thank you for joining us. In our usual fashion, we'll begin with prayer. Dear Heavenly Father, we bring Angola before you this afternoon as we go through this COVID cluster outbreak. We bring the Premier, my colleagues in Cabinet, and members in Council, and we ask you for wisdom. We ask you for strength for the health team, both in ministry and the health authority. And dear Lord, we ask you to be with us, the people of Angola, in a special way. We ask for the spirit of discernment and patience as we go through this moment, and we ask for healing for those who are sick. In your name I pray. Amen. Welcome to the fifth press conference held by the government of Angola in response to the discovery of a COVID cluster in Angola. Since that discovery, the Ministry of Health and Health Authority have initiated aggressive contact tracing and as a result have tested, quarantined and isolated over 700 persons while simultaneously vaccinating over thousands. In addition to this, the government of Angola introduced mandatory masking, prohibited measures including prohibited public gatherings, closed ports to incoming traffic, and closed non-essential business places. I'll now hand over to the Premier, Minister of Health, to speak about those new regulations.
Good afternoon, fellow Anguillians and residents of Anguilla. We are here with our daily press conference to update you as to the situation. As the Parliamentary Secretary reminded, we are in a cluster. This is a public health emergency, and this is one that we do know that if we follow the right protocols, follow the regulations, that we will get through it. I do want to say that at this time, you are responsible for your own health and for the country's health. And then that we cannot stress that enough, that we have to care about our brothers and our sisters, our neighbors, that we stay at home, that we follow the hygiene principles that have been working for us, the social and physical distancing, and we look out for each other. That is what is important. In terms of the regulations, those have been published. And the important takeaway here is stay home. Unless you're an essential service and you need to go out to take care of people, whether you work in healthcare, pharmacy, you work in the supermarkets, stay home. We do know that this is a trying time. Persons feel that this has been going on for a long time. We do have COVID fatigue. The important thing is here, if we stay focused, if we follow the protocols, we can get past this, and we will get through it. And we want to get to the COVID exit plan, which was previously laid out. We have July 1st as that date if we vaccinate enough persons, if we follow protocols, if we curb this cluster and prevent community spread, we can get to that July 1 date where we can once again have a chance that those vaccinated coming in would not have to quarantine, that those of us here who are vaccinated would not have to worry as much about if we get exposed, that we get infected, that we can transmit to those who can't be vaccinated. And we do have that goal that we want to reach. And so I'm urging and pleading that those of us who can be vaccinated, go out and get vaccinated, because we're not doing this to save the economy only. We're doing this to save our own lives. I thank you for that. In terms of yesterday, was raised about the certain items which should be duty-free. As I stated last year, There were items that were put in place that had duty-free concessions. It was intended that these the savings would be passed on to the consumers. Some of the supermarkets and other entities did that with passing on the savings and not raising their prices above the 40%, which was stated, and most didn't. There was a $4.1 million duty loss. That was revenue that should have been collected. And when we came in, we extended the duty-free concession program until December 31st. And then we had the supply officer go in and check the different stores, looking at items that were supposed to be where the price would be controlled, and found that in most cases that the price was elevated past the 40% profit, which was the guideline. And so we felt that we could not continue to extend that program. We were able to then say we could take some of that money, which would be gathered in customs, and pass it on in other ways to those who are most vulnerable, whether through social welfare or through social development. And, it was disheartening to see there was a post yesterday saying that the government raised taxes on hand sanitizer and napkins and other items by 15 to 25%. That was not the case. It's that when the duty-free concessions were allowed to expire, that they went back to duties. And the feeling was we were basically had given up $4.1 million between April and December of 2020. And that should have been passed on, and most of it was not. And so we are now looking at that again as to looking at the items that we can grant duty-free concessions on. But this has to be policed, and it will be if we do get it passed through Executive Council and in the House, that these, because there would be a financial loss implications, it has to go to the House. And the plan would be that if this passes, that it would be enforced very strictly. In terms of the regulations, and the Royal Anguilla Police Force is out making sure that these regulations are enforced, as was stated by Her Excellency the Governor. The United Kingdom government has said that any additional financial implications for enforcement that would be covered, and we thank the governor's office, and the UK government for that. Border Patrol will continue and will be revved up, and there will be boats on the water. There will be patrolling of the shorelines and the coastlines to make sure that there's no illegal entry. And we are asking Anguillians everywhere to be vigilant and to be the eyes and ears, so that because we see the detriment that has happened to Anguilla because of this situation, where it just takes one person being positive and getting out in the community, and this can shut down a whole country. And that is what we've been trying to avoid for over a year. The health team has done a magnificent job, first of keeping us safe and protected, and now of testing, contact tracing, isolating, quarantining, so that we can try to control this. So I am, pleading to the people of Anguilla, let's do this for each other, and let's keep this country on the right track. Thank you. I will now turn back over to the Parliamentary Secretary.
Thank you, Premier, for that update. We'll now move to the Chief Medical Officer, Dr. Aisha Andrewen, for the COVID-19 cluster update.
Good afternoon. Since our last meeting, we reported 55 cases. We're up to 60 cases this evening as of 3 p.m. Just note, one result came in after the press conference yesterday, so one is from yesterday, and then 4 additional positives this morning. However, those were 4 members of the same household. 2 adults and 2 children. The household has been under quarantine/isolation since last Friday. However, some issues were noted with the positive case originally identified as the positive household member. So we're seeking to rectify that. So that would have consisted, or that consists of 2 adults and 2 children. So that brings our total to 60, as I said before, linked to this cluster, with 53 adults and 7 children. Just to note a couple of points from this morning's development. The children that were identified this morning have no bearing in terms of this contact tracing for the school system, right? Their contact was an adult member that was household member that was identified on Friday. In addition to that, with their first negative test, they would have been pulled from the school system since then. So we're not looking at any onward contacts from those 2 children. Additionally, we can say that no persons are hospitalized at this time, and so on. As a segue into the vaccination, we know that recent research coming out of the UK, in addition to showing the stark differences in terms of the reduction in transmission, even from the first dose, if you recall, it's now been found that first dose can reduce transmission by 65%, second dose 80 to 90%. Further to that, the recent UK guidance is sharing that first dose vaccination from the first dose reduces household transmission by 50%. That's an extremely powerful thing because household contact is like the highest, one of the highest risk contacts. That has bearing on what we found this morning, because not only is that in line with what we've seen in terms of the big difference between the vaccination among our negatives, we're saying upwards of 50% versus the positive cases, around 15%, much lower. What we have seen is that in a couple of our households here in Anguilla, prior to this morning, we found that the vaccinated family member who had 1 dose is a family member who was not found, who was subsequently tested negative, compared to other family members, 1 or 2 family members who tested positive who are not vaccinated, in addition to that household member who was not vaccinated and positive. Incidentally, we found this morning that all 4 new positives were not vaccinated, neither was that household member that we found positive on Friday. That said, to date, we found that 7,448 persons have been registered on the portal. Of those, 6,599 have received a first dose. That's some of vaccine. That's somewhere between 37 and 45% of the entire population. Of that number, 1,833 have received a second dose or the second dose of vaccine. So that's where we stand with regards to vaccination. So I'm going to stop there for now.
Thank you, Chief Medical Officer. I have one question from the live for PS Health. Will the protocols such as masking be maintained after we move past this period?
We'll do that on a case-by-case basis. Certainly look at the epidemiology. And as we indicate, mask is basically the last step. You don't go do masking before. And if you don't have to mask, we won't. So we will look at that at that point in time.
Additionally, a question for the Chief Medical Officer. Can we have an update on the sample sent to CARPHA relating to what kind of strain is in Anguilla?
Remember, yes, it's there, and they started processing it yesterday, but remember, it only arrived in Trinidad on Monday afternoon, so it takes a few days. So it's only Wednesday. So as soon as we know that was going to be featured in the next press conference, once we know the result, we'll let you know. But we haven't gotten that result as yet. It takes a few days. They've already started preliminary assessments on the samples. It usually takes 3 to 4 days thereafter for you to get the strain.
I am responding to a question from our media team, DJ Hammer.
Yes, good afternoon, class from here. A question for the CMO. In terms of these positives, are there any coming for, new ones coming in, let's say from outside, those who would have been traced or isolated? And any new cases are popping up from the white community?
Well, at the moment, everything is linked to the cluster, and we have more or less exhausted the contact investigation. However, that said, we're not out of the woods, because every time you have a positive case and you contact trace, there's a possibility of new cases. So we'll have a very good idea of where we are in the next couple of days. There's nothing coming outside of the cluster, but we're still doing contact tracing from the cluster. And that's winding down, but we can't say where we are until we get that last positive case from the cluster and contact trace.
And how are we policing, those from isolation? Because I mean, I'm sure there are some persons who are concerned about that too. How are we monitoring them? Because they are not in a facility; they're perhaps, at a home or somewhere. How are we working with that? How are we policing that?
As best we can with the help of the constables. And this is what the PS raised a couple days ago. It's a very, what's that echo? Yes, as I was saying, that's what we said before. That's what makes this such a precarious situation, and that's why the general restriction of movements. It is not a nice control situation, like when you have a house assessment and you have guests coming in or repatriated persons coming in. It's not. We have advised and instructed persons on what they need to do. There's a lot that will depend on human behavior, which is always very dicey and much less easy to control. So that's where we are, and that's what we're saying. We had no time to, in an emergency situation, to assess every household and to find facilities for over 1,000 persons that are being monitored. So this is why we're asking the assistance of the general public. The police constables are doing a normal field work. Our surveillance team is doing a normal field work. It's a huge number of persons to monitor, and it's a very, very precarious situation. So we keep saying that. And hence the reason why we're asking persons to comply with the measures, and we're asking the general public. That's why this harder lockdown, harder restriction of movement. So that is the point. So a lot of this, again, it has to do with the public's responsibility. We cannot do it all ourselves. If persons do not cooperate, we will have community spread. We will descend into economic recession. We will have people dying. So people got to choose, and people have to cooperate.
I would just like to extend on that from a policy standpoint. The critical nature is the responsibility of each of us as citizens of Angola, not only to protect each other's health, but to protect our own health. As it stands right now, we cannot monitor over 1,000 people every minute of the day, 24 hours a day. What we have sought to do is to restrict the hours of movement, to restrict the hours where stores can be open, to ensure that people are home after 6 o'clock and stay at home, to recommend to those people who have been positive or persons who have to isolate or for contact tracing purposes to stay at home. That's as best as we can do right now. At the end of the day, all of us as citizens of Angola have to decide, are we going to act responsibly, or are we going to have an extended shutdown in this country? The measures that we have in place right now are as best we can do, or as far as we can go, without declaring a state of emergency. At the end of the day, if the virus does spread out of hand, the government will have no choice but to probably the state invoke a state of emergency to get people in a state where you can't even leave your districts, you can't even leave your homes, or in a way that we can shut this thing down. So as it is right now, we're trying our best to sort of ask you and persuade you in moral suasion to stay at home, to abide by the principles, and certainly to cooperate with the recommendation of the Chief Medical Officer and the health team. But at some point in time, if this does not work, we would have to go to other measures that would necessarily limit person movement further. Because at the end of the day, we are only a small community with limited health resources, limited financial resources, and God forbid anybody were to end up in hospital, then that would take a serious turn for the worse here in Angola.
Thank you, PS Health. I'll now move to the Anguillian.
Good afternoon, James Aragon here from Anguillian. I wish to ask a series of questions, maybe a group of questions in respect. I heard about the regulations a while ago from the Premier. What about the fines? Do we have fines that match those regulations? Do you have a catalog of fines or a list of fines that you can disseminate to us?
Well, the fines are listed in the regulation right now for each infraction at $2,500. But they also are fines that are in the Public Health Act, which go up to $38,400. And so these, will be strictly enforced, and persons will be prosecuted. And that assurance was given by the Commissioner of Police when he was on 2 days ago. And certainly you can see that the police presence is being ramped up, and any infractions we really are taking this seriously, because you've had enough notice now since last Thursday that this is in place and should be followed, because we just don't want to do this just because we want to restrict persons. We want to do it because we want to save lives, and this is serious business. This is a public health emergency. We are in a pandemic, and so the only times to be out, to go to the doctor, to the pharmacy, to the bank, to buy food or gas, or to get vaccinated. Those are essentially the only times we should be on the road.
I have another question that relates to the fines. I would take it that you have a certain degree of certainty as to the original or the initial cause of this situation we're in. You may have the root person or persons who's responsible for this. What kind of fines do you care to say will be administered or measured out against such infractions?
Again, that is being investigated by the police, the Attorney General, and we wouldn't know what that entails as yet until we know what the extent of the infractions would be, and how that is being done. But certainly, I know there's concern out there, and I would just like to say that it is being investigated, and that's as far as I can say right now.
Thank you to the. Now move to Brenda.
Good afternoon. Following on that, I wonder if there is any report from the police. Are people complying, especially to the 6 p.m. to 6 a.m. curfew, or have there been any breaches reported so far?
Well, based on the discussions with the police commissioner, seems to be people are complying as best as possible. I have not gotten any reports of breaches for the day, but certainly by tomorrow for our next update, I probably can get you any official breaches with regard to persons moving about who are not supposed to be moving about. But by and large, the police commissioner has indicated that persons have been responding very positively to the actions of the police. Having said that, I just still want to implore persons to who really don't need to be on the street, don't be on the street. Don't wait for the police to have to turn you back, or don't wait for the police to have to question you as to where you're going. If you don't need to be on the street, please do not be on the street. This is not a time for sightseeing. This is a time for being at home until we can get this thing wrapped up. Today is 8 days since the first cases were identified, and I'm certainly over the next 8 days we'll have a better picture where we are. But we would like to, at this point in time, please ask people to stay in place as much as you possibly can, and only venture out if you have to, for those reasons the Premier mentioned earlier.
For the PS Health, the question is, for those who have tested positive in the last few days, after they recover, the chances are they will not be able to be fully vaccinated using our existing stock, which expires on 31st July. Will they be accommodated to receive vaccination?
Well, we do have commitment from the British government to have up to a certain number of doses if we need them. I think the numbers are 26,000 doses if we need them. We currently have on island and have had since February 20,000 doses. So theoretically we can get more if we need to, but certainly it would depend on if we can, if we have the numbers to get up there, and we hope that we get that done. I think what is critical is that the Chief Medical Officer indicated that even with a first dose, there is considerable protection, not only to yourself, but there's considerable protection for other persons in terms of transmission. So even if it's not possible to get 2 doses before the end of the July 31st, it's very critical, and once people clear the virus, once they are feeling well enough, at least get the first dose, and we can look at getting second doses after.
Premier, you would have mentioned earlier about establishments not passing on the savings to consumers. There was a question about enforcement, and why was that not done?
That's a good question. The regulation stated that a supply officer was supposed to go and investigate to determine if the prices were in conformity with the policy of no more than a 40% profit margin. There was some hiccups in terms of getting a supply officer in place, and that's what led to that. Once we were able to get that done, then the investigation was done and the findings were brought to our attention.
Is there any fine for not masking in a public area?
Yes, $2,500 in the first instance, and that can be multiplied based on the number of infractions.
I'll now move to DJ Hammer. I believe that you just put your hand up.
A question for Dr. Webster, Minister of Finance. Dr. Webster, you spoke earlier about price gouging, and you just touched it again there in that last question that came from online. We would have heard and would have realized that the prices in America, our source market for goods, have been increasing steadily. Have that been factored into this whole thing, though? Because you mentioned savings not being passed on and the price still remaining high. Have that been factored into the mix?
Yes, that's a good question. And as the business persons know, that CIF value, which is used by customs to determine what the duties are going to be, the IGT, etc., that number, they have access to that information in their computers. And so when they go to the store, because the supply officer is usually the controller of customs or whoever they designate, when they go to the store, they use that information which they have, which was used to, based on the price, the insurance, the freight, all that information they have access to when they determine what the prices are at the store and then compare it. And so even though if the prices go up in the States, that will be reflected in the CIF value that they have access to here in Anguilla.
CMO, the question is one of clarity. You mentioned earlier about a family who would have tested positive. The question is, were they tested initially and showed negative, then tested again and subsequently resulted in a positive result, or was this their first test?
Yes, exactly what we said. They were tested on Friday when the household contact was identified, and subsequently a couple of them developed symptoms, and we learned that the isolation precautions were not 100% met. So this has been the challenge. So they had a negative test on Friday, and they have tested positive today, but there were issues with the isolation of the case.
CMO, another question for you is whether or not there should be a wait period between testing positive and receiving your first vaccine if you have not yet vaccinated.
If you have tested positive, the advice is, let's say a part of this cluster you've tested positive. The advice is you wait until you recover from the infection. That's usually around 4 weeks. And then you go straight into vaccination. So once you've cleared the infection, you can go ahead with your vaccination. The reason being, not because the vaccine is less effective, the reason being that once you have tested positive, you don't want to confuse any symptoms of the infection with vaccine reaction. So that's the reason for that.
Okay, thank you. I believe I covered all of the questions on the live. I'll ask the media team.
And of course, obviously, it stands to reason that if you're testing positive, you're isolated. You're not going to be out getting a vaccine if you've been identified as a positive case.
Right. So members of the press, do you have any additional questions?
One more, Foster Rogers. So in terms of the protocol, in terms of the restrictions, and maybe Minister of Finance, I'm not sure who will take it. For some persons today in particular here at the station, persons were concerned about accessing hardware supplies while they're home. For example, in the home, if you break a tap, you break a lock, you break something, you can't get it because the stores are being closed out. Your reaction to those type of comments, sirs, one of you?
Yeah, certainly these things would happen. There's always a risk of breaking a tap, for breaking or whatever. This happens on a household basis every day. But we can't make policy based on what might happen. We have to make policy based on the movement of people. And certainly if you've been to hardwares, if you've been to stores of that nature, and people moving about, you'll understand why we've done that. Additionally, we have indicated the construction industry is closed currently because we have had some positive cases in the construction industry. People moving about in hardware stores, people moving about in different areas like that. So that's one of the reasons why that had to be closed down. If there's an emergency that somebody needs to do something at home, we have to find a way around stuff. We are very ingenious people in Angola. I mean, at the end of the day, this is just for the next 10 days. Let's see if we can work through this and get things done properly.
Premier, a question for you, but before I go there, I realize that Radio Angola has just raised their hand.
Good afternoon. Dr. Andurian, you mentioned that the children that were tested positive was a result from persons in their families or the household. Are you confident that based on the testing so far that the virus has not affected the schools?
What we have seen in terms of screening the school contacts and we keep saying we have cast that net extremely wide, right? We can't say that we are not saying all those children that were tested, hundreds of them or whatever, were contacts. We just cast a very wide net. We have not gotten any positive cases via the school system from the kids that were tested positive. The kids that tested positive before, there was a direct link with a parent in the house. So let's get that clear. As with the case in this morning.
And that's why I'm also telling people, when you're quarantining, please quarantine properly. Certainly we know with children who are very, very young and maybe toddlers and infants, it's difficult to quarantine because you have to care for them. But in some instances, you have to be sure that when you're in your house, you quarantine properly. And that is why we ask people to stay home, because even if, let's say these children who have now tested positive, they are still at home. So that's why I tell people to stay at home so that then there are no tertiary infections from those children now who could have passed it to somebody else. So I think the stay at home, the isolation, the quarantine is the only way to stop this. And if it's done properly, it can work. But we're also getting some reports that there may be some people who may have symptoms or who may think they're sick, but they're not reporting to the health services. They're not reporting to the health authority or to the hospital or to the Ministry of Health because they're afraid they're going to be quarantined, they're going to be locked up for 2 weeks, they're not be able to work and these type of things. These are not reasons not to report and call the hotline and get your status checked. At the end of the day, we cannot have a situation where persons are afraid of quarantine and probably lose work for a week or two, and at the same time impact the entire country and have the country shut down for a month or two. So we ask persons to please look at the sacrifice that you make now. We have to look at what we call the long game. We have to ensure we have our eyes on the long game, not the short-term measures of being put in the house 2 weeks. If you feel you're positive, if you feel you've been exposed, if you have the symptoms, please call the hotline, please call the hospital, or please call the Ministry of Health to get the proper information so you can get tested, so you can be quarantined or isolated if necessary. This is a critical message I need to get out to people. It is not enough to feel that you're going to be quarantined so you don't want to do it, or because you're going to lose work for 2 weeks because you don't want to do it. It is necessary to get this thing stopped in the tracks, because if it is not stopped in the tracks, I can guarantee you, then you'll be out of work for more than 2 weeks.
Premier, there's a question on whether or not there's a number to call to report price gouging.
Well, there's no regulation in place right now regarding the price gouging, but we will get to that. And when we do, we will have certainly numbers that persons can report if they are suspicious that there is price gouging. I do know that some persons were sending around pictures of items that the prices they were concerned were elevated. Certainly these are all things that we are looking at as an administration towards price control, consumer protection, But as regards to specific to this incident where we would give duty-free concessions on items related to COVID, then we will have numbers in place once that legislation goes in to report price gouging and where we do not see the savings being passed on.
Premier, another question for you. How realistic is our May 6th date? What was the thinking behind this date?
And the thinking behind this date is, that the incubation period is anywhere between 2 to 14 days. And once we found that there was a positive case, we wanted to take that 2 weeks to reset, to pause, have people stay at home to curb the chance that the virus can pass from one person to the next. I don't know if the chief medical officer would have any further clarity on that, but that is the reason for the May 6th date. That was 2 weeks after we found that first case. And as we've said, that can be extended based on the findings. As we encounter positive cases, we'll need to know based on that assessment whether the May 6th date needs to be extended further.
Yeah, certainly. I want to echo that. That is exactly the reason. Bearing in mind that nobody is happy with any slowdown or restrictions. We want to meet deadlines. We want productivity to continue. We had to take that pause in the first instance to find out where we are and to contain. Now, I will say that the cluster is extensive, as we have been saying. If this were 2 households involved, this would have been so much easier. But that was the reason for the 2 weeks. We need to know where we are, and so we need to know what actions to take. Everything always depends on what you find. So we didn't say a month or 6 weeks in the first instance. Nobody wants to go there. We said 2 weeks. That's an incubation period. Let's see where we are, and then we take it from there on May 6th. And as we keep saying before, the findings are not the worst, but they're certainly not the best. It's an extensive cluster. It's a lot of people involved, still linked to our cluster, but we have to take aggressive measures now.
The other reason as well is a constitutional reason, is a legal reason. You have to do stuff in a measured way. When you have facts before you, you do stuff based on the facts. You cannot simply put in a restriction of movement for a month or 2 months if you don't know the facts. So you do stuff on a measured basis with the facts before you. So if there's a need to extend for another 2 weeks, we'll do that based on the facts.
Question for the CMO. Are any senior citizens amongst those tested positive?
Certainly. We have a number of persons. What do you mean senior citizen? This can be a tricky one. Over the age of 65, a few. So far, we've kept it just adult and child, but we can have that breakdown for you next time. But so far, no one's hospitalized, knock on wood, and vaccination is emerging as something good in terms of what we're seeing, the so-called contacts that have been exposed. You're seeing many more persons. 50% of persons who are testing negative have had at least one first dose of a vaccine, compared to around 14-15% of the persons that are testing positive.
Thank you for that. I see the hand of the Anguillian.
Thank you very much, Mr. Mary. Don't Mary, sorry. In terms of the churches, God forbid that this shutdown of this pause will be on 2 weeks or maybe 6. But is there any provision being made even now, or would there be any provision made in the future if it is extended shutdown for church services for maybe a limited number of people, maximum number of people? The whole church services, and then the regular congregation would view via virtual platform.
When we put the restriction on church persons last week, we had 3 cases. We're now up to 60 cases in the community. I think we have to look at this in perspective. We have to look at this in terms of the possible risk of the country. At this point in time, there will be, we'll look at it again at the 6th of May, but I can tell you, more than likely, church will have to go on probably virtual for a while. For instance, in the States, most of the churches in the States have been going virtual for almost a year. So we have to understand that this is an existential threat to the people of Anguilla. We have to understand that we must take these sacrifices now to ensure that by June, July, if we do this properly, we can come out and have church again. But at this point in time, we're going to be looking at the numbers, looking at epidemiology to ensure that we make the right decisions.
There is a question about returning Anguillian students. Will they be accommodated? Are we minded to accommodate them, and if so, when?
I'm sorry, can you please repeat that question? I was taken up with another comment here. I'm looking at stuff live as well. Can you please repeat the question?
No problem. So the question is about returning Anguillian students. Will we accommodate them? And if so, when will we be minded to do that?
Just like last time, it took a while for us to accommodate returning students and returning residents once we had a grip on what was happening. So I really won't answer that right now, but what I can say is ask persons to stay in place, and we will make the decisions when the information is available to us to make decisions like that.
DJ Hammer, your hand is up, but I'm not too sure if you put it down since the last question.
Yes, I'm here with a question for the PS Rogers. A question, so do we have sufficient testing kits if the process was to be extended, contact tracing, etc.? Do we have enough kits? That's one question for you. And another question is those long lines that we have seen at at one of the telecoms companies in the last couple of days. How's that being dealt with?
Yes, we do have enough tests. I wouldn't worry too much about the tests at all. We do have testing capacity. With regard to the person at the telecom lines, telecoms have been closed. There was an issue this morning, but we dealt with that. Telecoms have been closed for the specific reason that I think at this point in time, we do need to have enough people, as many people off the road as possible. So telecoms have been closed for retail purposes. We have allowed in the regulations persons who are at the technical end to be able to treat with the equipment to ensure that the service stays up. They can work, but certainly telecoms have been closed for retail services.
And one more question, please. This is coming from one of our listeners here, understanding that people who may have tested positive and may be reluctant to come forward because of the difficulty in functioning daily, does government have a safety net in place to help them? For example, to someone to shop for them? That's one question. Another one from a hotelier here is ask if vaccinations are mandatory for visitors to come to Anguilla. What happens for those persons who cannot be vaccinated for health reasons, but have always come to Anguilla over the years?
With regard to the question about vaccinations, those persons who cannot vaccinate, when we do open the borders, we'll have to quarantine. It's as simple as that. I think that the period is up to, when is it, August? I can't recall exactly, but there'll be a transition period. Additionally, we in Angola need to get our numbers up. That is the protective measure. The protective measure is not whether somebody comes in, whether they're vaccinated or not. The protective measure is whether enough of us in Angola are vaccinated to ensure that we cover those persons in Angola who cannot be vaccinated. And that is what we call the immunity issues and the herd immunity issues and the community immunity issues, so that we in Angola need to be covered. That is what we are stressing. We are stressing coverage in Angola to ensure that when persons come in who are vaccinated, and persons even not who can't vaccinate, because children at this point can't vaccinate. So we want to ensure that persons understand that it is coverage in Angola that will protect us. That is the measure that we try to get up to.
I'll just answer with regard to the support for persons under quarantine. Remember, we've been doing this for many, many months now. That is part of the assessment. Persons are asked to identify who will be dropping off food and so on and so forth. So that's nothing new to this cluster situation. So that's one of the provisos that has to be met. And if not, then we pass it on to somebody from social development. But so far, to my knowledge, that hasn't happened in this case. But that's the usual process, part of the process for quarantine and isolation.
There is a question about who is considered an essential business. I do believe that this question was asked and answered numerous times, but for the avoidance of doubt, I will read the list as published. The Health Authority, pharmacies and suppliers of oxygen, residential care facilities, private and public, the Royal Anguilla Police Force and Anguilla Fire and Rescue Services, Her Majesty's Prison and the Zeneda Haven Residential Center, Ministry of Health, Disaster Management, Governor's Office and the Attorney General's Chamber, Immigration, Customs, Government Waste Disposal and Sanitation Services, mortuaries, security companies, water corporation, electricity companies, telecommunication companies, radio, General Post Office, private healthcare facilities, the House of Assembly, grocery stores or wholesale food and drink suppliers, restaurant and bakeries, gas stations, private suppliers of water, private commercial cleaning companies, commercial banks and money services, shipping and brokerage services, Department of Social Development, Department of Probation, Treasury, Inland Revenue, Fishing and Agriculture Industry, hotel, villas, guest houses, and other accommodations who are open and occupied with guests, as well as the Anguilla Air and Seaports Authority. I'll now move on to a question from the Anguillian.
Thanks again, James Aragon here. A question for the Premier. Has the UK government initiated an additional amount of funding to Anguilla at this time, particularly for border protection, and how much?
Well, that was answered previously on a different day, but yes, for additional monies that would be needed or assistance that would be needed for enforcement, UK government has granted funding. I don't know if the governor had said specifically how much, so I don't want to give a number, but certainly in previous releases, she did confirm that there was additional money granted for border security. In terms of the next question that you'll ask about financial assistance for COVID relief, I have raised that issue that if this is extended past the 2 weeks, that we would get into a situation where that may become necessary to continue unemployment and underemployment benefits, just as was previously done. And so this is, we are evaluating our financial situation currently. We are looking at the projected revenue loss that we are undergoing right now during this 2 weeks, and any further loss that we would have if this needs to be extended. And so that's why it's important that we understand that the decisions we make right now can affect us not only for weeks, but months and years to come. We have limited resources. We want to make sure that everybody is, taken care of as needed. As we go forward, the more resources we use up, or the less revenue that we can collect, then it puts us into a financial bind, and that can have repercussions with economic scarring, with the inability to take care of our health needs, because healthcare is expensive. And as we go forward, we need to take this into consideration. So that's why I reiterate, stay home and let's protect our own health and protect that of our neighbors. And thank you.
Pierre, your hand is up.
Yes, if I can just add, Premier, the UK government has given us phenomenal support. We have gotten support since the beginning of this pandemic, since last year. All of our testing equipment has been free. All of our test supplies have been free. We have gotten persons in terms of technical staff, which they're paying for. We've gotten Cuban Brigade that was here and then extended. We've gotten vaccines free that people can even buy on the open market. We get technical assistance from them every day. We have a direct hotline to Public Health England, where the Chief Medical Officer and the team there can speak almost 24 hours a day to get advice and to get stuff. We have gotten funds in terms of the border control. We have gotten funds to take care of our special constables for many, many months. So the assistance from the British government has been phenomenal. I must say that it's time for us as Angola now to take up some of our responsibility. We've had the vaccine here since the first week in February. At the rate we were going in initial vaccinations, we could have vaccinated close to 10,000 people by now. So I think at the end of the day, we have to put things in perspective and not only look at what monies the British can give us now in terms of helping us secure the borders and so forth, but what money they've given us over the last few months to assist us in getting back to a level of normalcy, to assist us in opening the borders. And the exit strategy we had that was approved in Council a few weeks ago, in that strategy, we determined that by 1st of July, we'd be in a certain place to be able to open up even more than we've opened up since last November. So I don't want us to feel that we are now looking to the British for help and that they're not helping enough, and we need this and we need that. They have been helping at a phenomenal rate. And I think we as Angolans have to realize that we have to step up to the plate and do our part.
The question has been asked, and it was answered numerous times before, about mixing of vaccines. The answer is no. You cannot mix your Pfizer, AstraZeneca, Moderna, and anything else that you may have had before. If you had a first dose with one vaccine, you have to get a second dose with that same vaccine. We have 3 questions before we close. The Anguillian, then Clan, followed by DJ Hammer.
I'll just move to ask a question concerning border security again. Last year when we had a shutdown, there was a very stringent regiment of border security. We witnessed planes flying overhead every other hour or so, and there was a tight clamp on our borders. Somewhere along the line, that security was more or less relaxed. Now that border security is back in place, how long after the 6th of May do you foresee border security being retained?
Well, James, I think the best to answer that would be the Commissioner of Police, but I can assure you that the border security is being ramped up. One of the issues, of course, that allowed some relaxing was the resources. It takes a lot of money. I think it was like $800 and something thousand a month to keep Operation Iron Dome in place. We have to be responsible as Anguillians, to make sure that when we see any type of breaches, illegal activity, that we report it so that the police can respond. But I can assure you that the border security is now ramped up and will continue. And, we will ask the Commissioner in terms of the length of time. I think that this is something that since COVID will be around, once we, have to protect the borders, we will.
Clan S, I can't see your name, sorry, so I can only refer to you as that.
I think that's clean street.
Oh.
All right, DJ Hammer, Class FM.
Oh, okay, yes, I'm here. We would have mentioned that the post office is among the essential, entities, in this country. And there are lots of people who have merchant medication, they're saying, and supplements and other necessary supplies shipped via the post office, and they can't get them. That is a concern. How can we address that? Those persons have been asking this question for the last day or so.
Yes, I can tell you under the regulations, the post office is approved as an essential service, particularly for those things, medications, nutritional items, and so forth. It certainly is not approved for a lot of the other stuff that you normally get at this point in time, that because we are in the middle of a shutdown. But it has been approved to be open, I think, for money services as well as for medications, nutritional support, health products, and those type of things. I think they are now working to get the hospital open in that regard. Sorry, the post office open in that regard, and you will get some information on that shortly.
Clean stream, I think.
Yes, it's clean stream. Question: what measures are taken or will be taken in a case where a child that is not eligible to take the vaccine gets the COVID, let's say beyond just a simple cough or a little body chills?
That child will be hospitalized and managed as best as possible, but therein lies the point. We want to avoid that by getting the herd immunity. Initially, many months ago, it was already shown that all these vaccines are highly effective and nobody dies. It mild disease, asymptomatic disease, and further to that, the evidence is more and more powerful and robust as the months go on. These vaccines are reducing transmission. That's what we want to get to, so we don't have to have these conversations. And in the future, children will be eligible for the vaccine, but in the immediate future, the answer is vaccination. And that, I mean, we're talking about the evidence that's coming out almost a daily basis to talk about the precipitous drop in transmission to protect those who cannot vaccinate. And this is the idea of herd immunity, so that that virus cannot jump around from body to body to body. And that is how the children and others who cannot be vaccinated will be protected.
And in fact, to add to that, we have real evidence in Angola. We have evidence through this cluster that there are families in Angola who one parent was vaccinated, didn't get it, one parent not vaccinated, got COVID, and the child has COVID. This is evidence here. You know, it could have been quite different if both of those parents were vaccinated. So the evidence is not some evidence you read about in papers. Of course, you can read it in papers. You can look at what's happening. There are papers from Oxford in the UK. The paper that was just done that shows transmission reduced by 50% from the UK from AstraZeneca. You can read those papers. But certainly, there's live evidence here in Angola that if adults get the vaccination, those people who can be vaccinated, it is very unlikely that transmission will pass on to your children. Very unlikely. And we want people to understand that this is happening really in Angola.
I'll take the last question from Brenda.
Yes, thank you. This is a question that came in on my phone from somebody. And the question is, how is it possible to allow up to 12 persons to attend a wedding or funeral service, but not possible for a team to live stream a service from the church involving less than the 12 persons?
The way we have been dealing with this in the past, as you remember when we were shut down last year, funerals were not being held in churches. Funerals were being held outside, close to the graveyard, close to the cemetery, in open space. When you do the numbers, certainly for a funeral in particular, if you look at the pastor, the priest, that's one person. If you look at the attendants, if you're in attendance, at least 2 or 3 persons. So you're already up to 4 or 5 persons there. So the number of 12 persons is set in an open space to allow as minimal people as possible to attend these functions. All right. So the churches are closed. But the way these things operate is that persons have been doing these activities in the open space so that the virus is much less likely to travel from one person to the next. At the end of the time, when we look at other regulations coming up as well, it is possible that when we look at the next set of regulations after May 6th, we may at that point in time deal with live streaming church services with minimum staff, 2, 3, or 4. But at this point in time, we do not want people to be in enclosed areas for too much of a long period of time to increase the risk of transmission.
In wrapping up PS Health, I'll ask you to give your final remarks. Before you do so, I will say that if there are any questions that persons may have had that was not answered on this live or was answered in previous lives, a frequently asked question sheet will be published shortly, where you can always refer to it to answer any questions that you may have, and it will be updated. PS Health.
Thank you very much, Parliamentary Secretary. The Ministry of Health is certainly working with all levels of community, whether you are at home, or whether you are an essential service, or whether you're an extremely essential service. We are trying to liaise with people at all levels to ensure that we get through this pandemic. We're doing contact tracing, we're ensuring that person have the right information. We're also doing vaccination. So it's an all-out effort to ensure that we get through this and reach the other side, we are much better. We're not going to get everything right because at the end of the day, we are human beings like everybody else, and there are going to be glitches here and there. So if you call the hotline once, you're not going to answer, call back. There are persons who are there 24 hours answering phones. There are persons who are going to give information, and sometimes when you call the line, they may be already speaking to someone else. So we ask you to bear with us in certain regard, but I think on end, we are trying our best to ensure that we meet the needs of the public, to ensure that we get to the other end of this better than we were before. We're now 8 days into this. We think we have a better idea of what's happening. We have done most of the contact tracing for the initial set of persons, and we are hoping that those persons who are in quarantine, please stay in quarantine, please isolate to ensure that we do not spread this even further. For those persons who may feel sick, those persons who have symptoms and you are afraid to be coming to be tested, please don't be afraid. It doesn't matter where you're from. This is public health, and we do stuff as a public health institution. And I want to assure you that we will keep your information confidential. We will ensure that you get the best information, that you get the best advice, and that you get the best treatment if that is also necessary. We want you to have a good evening. Please stay off the road as best as you can. Please only leave your homes for essential purposes. You've noticed at the Ministry of Health here, we send our staff home at half day because we want to make sure that they do get at home and don't have to be on the road if they don't have to be. So once again, I want to thank you so much for the support. Again, we want to thank persons for all of the well wishes. We did get some boosters yesterday from private sector. I think it was a juice bar that sent us, I think, 8 boosters to members of the health team, both here at the ministry and at our hospital. I want to thank you so much for the support you've been giving us. And I know the Premier mentioned about a honking of horns the other night. That was very touching, very emotional for us. But we want to thank you as well for your support through this difficult time.
Thank you, PS Health, and definitely thank you to the Juice Bar for their kind contributions. As you would have mentioned, the key to this is vaccination, and I will now turn it over to Premier and Minister of Health, Dr. Webster, for his closing remarks.
I too want to, say what an invaluable contribution is being made by the health team, the Chief Medical Officer, Permanent Secretary, Ministry of Health, the Health Authority of Anguilla, the police, the special constables, and surveillance team, the monitoring teams, to get us here where we are. The work of the ones who are doing the testing is it's admirable because they're working tirelessly to check everybody. They've checked over 1,000 persons. We do have the 60 cases, unfortunately. But if they stay home and isolate, if their family members stay home and isolate and quarantine, if all those who have been told by the health team to stay home, certainly you can get a family member from elsewhere to drop food off for you and do the shopping. That would have been, set up. I'm asking persons to go out and get vaccinated. And we do know that the risk of any adverse reaction, any side effect is very low. But if you do feel that there is a side effect, if you've been vaccinated, then you can call 235-4357, which is 235-HELP. And also the COVID hotlines, if you have any symptoms or if you're concerned. Call either one of these lines first before you show up anywhere, and they'll tell you where to go, whether to the Ministry of Health to get tested or whether to the hospital And it's 476-7627 or 476-SOAP, SOAP, or 584-4263, which is 584-HAND, HAND. Or you can look at Facebook or at the website www.beatcovid19.ai. I do hope that these press conferences are informative. You're able to ask questions. Everything's being transparent. Certainly there's a level of confidentiality that is necessary when you're dealing with person's health. And so some of the questions you may have that it seems are not being specifically answered, it's because the person's health has to be protected. And I want to assure you that the police and the Attorney General's offices are investigating. And this is necessary. And I want to continue to thank all those who are working hard. Thank you to media for showing up. Thanks again to the Parliamentary Secretary for leading this press conference in such an efficient manner. And, you know, we'll be here again tomorrow at 3 p.m. to update you and to answer any questions and concerns. So I want to say, be safe, stay off the road, stay at home, take care of your health, think about those around you, and may God bless you and continue to bless Anguilla. Thank you.